Leslie. Okay. Welcome, everybody. So we, thanks for your patience. We have 5 official members. We are having an issue with one of our members getting here. So I am going to back chat you, Leslie. In fact, are you able to do that? We are going to get started and manage this technicality in a minute. But let's get started. So is Mark not here? Hi, Alex. Oh, Mark is here. Great.
I'm here.
You're back in. Awesome. Thank you. Sorry, it's been a little wacky over here. Homebase, are you sharing slides or should I? I'm happy to do it.
I can share slides if it's easier.
Okay, that's great. And Mark, let me also make you a co-host. Welcome everyone to the first Equity Committee of 2025. It's not usually this frazzled right at the beginning, but so be it. Sorry, let me turn off. We're getting used to being in this room. So I am Jamie. I am the staff to the Council on Homelessness, work for Health, Housing, and Homeless Services. Super excited to have you all here. Maybe we'll do H3 staff introductions and then Homebase and then council. Sounds good. Great. Do you want to introduce yourself?
Oh, hi. Hi, everybody. I am Jamie Schechter. I am a homeless services chief here with H3, also known as the other Jamie. I use she, her pronouns, and it is good to see you all. I'll pass it to Janelle.
Hello, everyone. My name is Janelle Fletcher. I'm the Research and Evaluation Manager with H3, and I'm happy to be here.
And then Homebase, do you guys want to introduce yourselves?
Sure thing. Hi, everybody. Mark Mora, work with Homebase, pronouns he, him. I'm here as kind of staff support as Homebase provides technical assistance, training, and support to various aspects of the Contra Costa COC. Pass it to my colleague, Alex.
Hey, everyone. Alex Mitchell here. My pronouns are she, her, ella. And a ditto to what Mark just said. Happy to be here.
Thanks, everybody. I want to introduce the council members who are official committee members of this committee. So Juno, who is not here today. Leanne, you want to wave? Woo, new council member Leanne. Leslie, who's actually going to be stepping down from this committee right now, which will also help us with quorum. Nicole, do you want to introduce yourself?
Yes, hi everyone. Nicole Green, she, her pronouns. I am officially the chair of COH and I sit in the reentry seat. So hello.
Excited to have you. Rena.
Hi, I'm Sharina. I sit in the homeless provider seat. I work for CORE and I'm a care coordinator.
Awesome. Yeah.
Hi, I'm Yahel and I have the youth advisor seat for the council.
Awesome. And then for folks that are online, you're welcome to introduce yourselves in the chat. And we do have one visitor here in the room. Who are you?
Hi, I'm Josie Asensio. I'm a pastor in Antioch, and also I am a part of the Interfaith Council for Contra Costa County Governing Board, and I am the new chair for the Seventh-day Adventist Task Force on working with ending homelessness in Contra Costa.
And she's involved in a million things. We had a conversation this morning while she was
Yeah,
driving
it
from
was
one
great.
thing to another.
Thank you.
Awesome. Great. I think that's it. Let's move forward. The next slide. Awesome. So I'm going to turn things over to Mark and Alex and just confirming you guys can hear us okay. Is that correct? Okay, great.
Awesome. Thanks, Jamie. Thanks, everyone. Yeah, so we will now talk a little bit about just give you a little bit of a 101 sort of introductory to the Equity Committee, because I think there's a few of you that are new to the committee. So we figured that might be a good first step to get you acquainted with the committee. All right, thanks, Mark. So we wanted to give you a little bit of a history of how this committee sort of came to be. It has its roots. Oops, I'm really sorry. That is my timer. I am making sourdough bread, and I just had to right before we hopped on, I had to take it out of the oven, so that's done. Anyway, in 2020, there was the Racial Equity Action Lab. So Contra Costa pulled together the cohort to participate in this action lab to advance racial equity in the Bay Area homelessness systems of care. And so during this action lab, they were deciding to focus on better engaging people with lived experience. And then you should have access to these slides, but if you want more details on that, you can go ahead and click on the link that's there. I'm not going to go into a lot of detail there, but that is available for you. And then in 2022, C4 Innovations was hired to conduct a racial equity assessment of the Contra Costa COC. And then also there was 4 equity trainings and a guide for engaging people with lived experience that were put on in 2022. And then also in 2022, there was the equity working group. And so this work group reviewed the equity report, identified top priorities, and then recommended creation of the COH Equity Committee, which is what you are a part of now. And so that was in 2022. And then in 2023 was when the official committee started. One of the goals was to focus on making sure the playing field was level for people in need of services by focusing on creating accessible information, outreach, as well as educational materials. During this process, the amplifier list was created. And then some of the other work that was done was revising flyers, creating FAQs, and explainer videos to increase accessibility and equity. And then in 2024, the goal was to provide input to all COH committees and working groups, which that happened throughout the year. And then also to partner on equity-focused projects and strengthen relationships with partners that are essential to increasing equity. So that's sort of like the history of how this committee came to be. We can go on to the next slide. Thank you. So the purpose of this committee, I'm sure you've seen this probably when you all attended the last COH meeting, but the purpose is to increase awareness, community dialogue, and lead concrete actions to achieve equity throughout the homeless system of care here in Contra Costa. You can go to the next slide. So these are, excuse me, some of the annual priorities that the committee has discussed over the last few years. You have 6 years. So the first one is to monitor metrics related to equity in the COC, provide input to COC policies and procedures, learn about topics and programs impacting equity and homelessness system response, develop the equity dashboard or an equity dashboard, which we will discuss a little bit later on today. And then also leverage partnerships to increase participation in equity committee, and specifically with a focus on getting folks with lived experience to participate and provide their insights. And then also develop projects and recommend priorities within COC to address root causes of racial disparities in the homeless system of care. So these are the annual priorities that the committee over the years has developed. Go to the next slide. All right, so who is the audience of the committee? Of course, we have providers in the homelessness response system, and that's all providers within the COC, whether they're COC funded or not. And then we also have partners interested in increasing equity in the homeless response system, people experiencing homelessness or at risk of homelessness, and then BIPOC, LGBTQIA+, and other marginalized communities interested in equity in the COC. Next slide. And then to give you a little bit of context or what to expect as being a part of this committee, we will ask that you all provide input on key equity initiatives. Y'all will help with the development of a COC-wide equity dashboard. And as I said, we'll talk a little bit more about this in more than a few slides, but later on in this meeting. And then we will also ask y'all to review materials in advance and participate in conversation. All of you are here and you all have such great insight. So we really hope to, provide that space so that you all can contribute to this conversation. And then we also ask that you all spread the word. So take what you learn in these meetings and, spread the word to your communities. And then the last thing you see here, it's advice, not decide. And the reason being is that the committee will make recommendations to the council, and then it's ultimately up to the council to vote on some of these items. So we are not, as a committee, we're not making decisions, but we are advising the COH. I guess I'm going to stop here before we go on to the next slide. Does anybody have any questions? Comments?
And I know it's a lot of information. You don't have to like understand all this and all the structure.
Yeah.
Like this is just like big overview, and we're gonna get into like actual stuff that'll make it a little easier to hold up to.
Yeah. All right, let's go to the next slide. So this is the tentative schedule for 2025. It is, I'm always bad at explaining this, but we don't meet every month. We meet 3 times a quarter. It's hard to explain. Maybe Jamie, you're better at explaining this. But we'll meet this month, right, today, and this will be in person. In March, we'll meet again, but it'll be virtual only. And then April, we skip. So there's no meeting in April. And then we start that process again. So in May, we'll meet. It'll be in person. June, virtual. July, we skip. And then we come back in August, again in person. September, virtual. October, we skip. And then we come back November, which you see that highlight here. It is on Veterans Day. So we will have to discuss whether or what date to change it to, because it's under understanding that most folks will be off. And then we'll have the last meeting of 2025 in December, and that'll be a virtual only. Do folks have questions on that? Okay. All right, so now we're going to talk a little bit about the work plan. What we've done is we've broken it down by quarters. I'm not going to go into too much depth into all of them. I think for today, we'll focus on Q1 just because that's the quarter that we're in, and we want to make sure that folks are in the know of what to expect this quarter. But the rest is in the slide. The rest of the quarters are in the slide. So feel free to take a look afterwards if you want to see more details. But yeah, so this is our Q1. So that's January through March, right? So really what it means is this meeting today, February, and then in March. So our goals are to orient new members. So that's, what we're doing today. We will review/edit the work plan. So we'll also, this is what we're doing right now, and then provide input on COC projects. We will have an opportunity later on to discuss the dashboard. So we'll do that then. And so some of the activities we're doing is providing input on new funding opportunities, provide input on governance, committee revision of COH bylaws, and then some of the work group activities are to begin development of the equity dashboard, which will begin today. We'll begin the conversation today. Monitor and advise on COC participation satisfaction survey and VI SPDAT replacement. We'll give you a little bit of insight into the participant satisfaction survey today as well. And then meet with 1 to 2 stakeholders to hear about and learn about equity topics impacting homelessness. So we won't get to that today, but hopefully during the next call we will. All right, so this is can we go to the next slide? So this is Q2. You'll see that some of the items are a little bit different. Like I said, I'm not gonna review everything because I think we've got a lot of other things to cover today. But if you ever have questions, you can come back and take a look at these slides. I will say, some of these, as I said, some of them are similar. Like if you see in the middle section, provide input on governance committee revision of COH bylaws. So you'll see some things that repeat throughout the quarters. Next slide. Thank you. So this is July through September. Again, not going to go through all of it, but you'll see some of the things, some of the items that are still coming here or are still showing here. And then we have the last quarter, quarter four. Again, we don't have a meeting in October, but we'll have a November and December meeting, which we will hope to cover some of these items there. And I think I'm going to pass it to Jamie Schechter, who will walk us through funding. But before I go there, is there any questions?
None here.
In the chat. None in the room. Awesome. I'll pass it over to Jamie Schechter, who's going to walk us through, give us a little bit of an overview of Funding 101. So this is kind of like the first learning topic of the year. So over to you, Jamie.
Alex, so you're gonna hear a lot from me because I've got back-to-back agenda items, so if you get tired of my voice, sorry. But if you go to the next slide. One of the reasons we wanted to, or many of the reasons we wanted to bring this kind of 101 topic to folks is so we're all starting with a baseline of understanding. We come to you all and we use acronyms like HUD, COC, HAP, MHSA, all the acronym soup you can ask for, right? And I don't think we've ever stopped to take a step back and say, is everybody on the same page? Do they know, do you have the baseline? What is public funding? And funding can often feel really hard to understand. And you're like, well, why does this person get the contract but that person doesn't? And we know that funding influences resources and activities that our service providers and the county is undertaking. And we also know that applying equity principles to funding decisions can improve our system response. So if we're trying to have activities that are improving equity in the county, then there probably needs to be resources applied to those activities. That's the whole kind of background and purpose of why we're starting with this kind of broad topic here. Yeah, the next slide. Just kind of at a high level, how are homeless services funded? There is local funding, and one example of that is Measure X, and that's a sales tax that we have here in Contra Costa County. And the Board of Supervisors authorized a housing fund as part of those revenue collections, and some of those housing funds go towards homeless services. We have federal funding. So at the federal level, one example is the Continuum of Care, and that's funding administered by the U.S. Department of Housing and Urban Development. We have state funding, and one example here is the Homeless Housing Assistance and Prevention Program, or HAP, and that's administered from the state, California's Department of Housing and Community Development. And then kind of this fourth bucket is around philanthropy and fundraising. So one example is a private foundation in the Bay Area, Tipping Point Community Foundation. But our nonprofit providers are also fundraising and getting, individual donations or grants from other foundations to continue to do the work. So all of these pieces are funding homeless services. For the most part, a lot of homeless services are not an entitlement program. So it's not like Medi-Cal, that's a benefit that's built in. It's not like Social Security benefits. It is a lot of grant funding that goes into homeless services. Go to the next slide. And how is funding used? So most funding, comes with restrictions. There's going to be requirements on who's being served. Is this funding only serving veterans? Is it only serving foster youth? It's going to be coming with requirements on what types of services are allowed. A lot of times you can't use continuum of care funding for emergency shelter. That's not an allowable activity. It's going to come with limits on administrative use. So things like data, your accountants who are managing your payroll system, your fundraisers at nonprofits, those are often just bumped into one bucket called administrative uses, and you get like 5% of your budget that's allowed to go towards that. Some very generous funders might have higher limits than that, but a lot of times you're really dealing with limited resources to support your infrastructure. There are deadlines for funding, particularly at the state level. They want to see the money that they're investing have quick outcomes, understand. But what that means is we have to move really quickly or create new processes to make sure we can deliver services within those deadlines. And there are training and policy requirements. So, you know, a lot of communities didn't adopt housing first because that was what they wanted to do, but it's because the federal government said, actually, if you want this money, you have to be housing first. So a lot of times, it's not just here's a check, go spend it how you need to. It is here's a check and all the strings that come with it. Sometimes those strings are good, like housing first. Sometimes they're less good, like 10,000 page reports. I'm exaggerating, but you know, just an example. Any questions so far? I know I'm a fast talker, so slow me down if you need to. We go to the next slide. So what role does the county and the continuum of care play? So we often play the role of applicant. So for the continuum of care notice of funding opportunity, when we ask HUD for our big chunk of money, we are developing the application and developing the process to do that. We are often an administrator of funds. So when we publish an RFP and we're overseeing the whole process, that's us playing the administrator role. We are a grant monitor. So when someone gets a contract from us, it's not just, okay, see you never. It is, let's have a quarterly check-in. Let's look at your data. How are you achieving the outcomes that we agreed to with this funding? And we are a reporter. We report on things like our system performance measures to HUD. We report on like how our grants that we're then subcontracting out are going to whatever funder is giving us funding for those. So we play all of those roles, and many of our service providers also play all of those roles. So everyone wears multiple hats in this funding game. Go to the next slide. How do we award funding? This can feel very opaque or very hard to understand for folks because they're like, okay, well, you know, the governor just announced $1 million going to this thing. What does that mean? Who did that go to? How did they get it? Oftentimes, public funding, especially coming from the county or the state or the feds, it needs to go through a very open process that's usually happening through a request for a proposal, a request for information, or a request for qualification. Essentially, this needs to be a competitive public process so that folks can learn that this money is available, they know how to apply for it, and that they are scored in a transparent way. So the public and, you know, the government is making decisions that are based on whether they're the best value to provide those services. It doesn't always mean they're the cheapest, but it could mean that they are the best, you know, provider for those services. And this will typically include a written application and a pretty strict process. So for example, our Consolidated Housing and Homeless Services RFP, I forgot the own name of that. That includes our Measure Housing Fund and a couple other funding sources. It had a very tailored template for how people are going to apply. You need to answer these specific questions. And it let all the applicants know, here's how we're grading you on each of these questions. So hopefully people understand like what they should write in those responses. It also includes things like, hey, you need to be in good standing with the Secretary of State as a nonprofit. You need to have your W-9 on file. You need to do X, Y, and Z things to be able to do business with the county. And then depending on what type of opportunity folks are applying for, funding decisions can be made by staff or by a panel. And so for this last RFP, we had a panel comprised of community members, county partners, philanthropy partners, lots of different people who are helping inform the recommendations we'll be making. But sometimes if it's, you know, a small pool or a small amount of funding, it might be something that sits with staff to say, okay, well, we got 2 applications for this. We're going to go with this provider for X, Y, Z reasons. That's really high level, I know, and it'll be a little bit different for each and every kind of funding source out there. But happy to take any questions or anything that surfaces for y'all.
So this happens like for cities too, who, okay,
Correct.
so, and it might be the same
Services.
the same people who want the money.
Yes, exactly.
Right.
Yes.
Okay, okay, got you.
Yeah, so like, The same
With
provider
Measure
could
X.
apply for Measure X. If the
Right.
city has something, they could be like, hey, I could provide services for you. So yes,
Right,
you'll
for non-
often see
okay,
the
gotcha.
same group of people applying for all these different kinds of things.
Okay, yeah,
'Cause we don't have like a super huge group of providers in the community, but
right,
so,
okay.
yeah.
Yeah, our non, so like I said earlier, we're puzzle piecing all the funding together. We're applying for state, federal, local. Our nonprofits are doing the same.
Yep.
Same thing.
And cities too, right?
And our cities are doing the same
Yeah,
thing.
and-
Exactly right.
Gotcha.
All right, next slide. Okay, and so now we get to, how do we incorporate equity into this whole process? So I'll talk a little bit, because this RFP has been kind of the most recent opportunity that's fresh in memory. But we did a lot of stakeholder engagement before we released it even. We asked, hey, how did last year go? Are there improvements you would make? How do we lower barriers? How do we make sure that this is accessible to people? We incorporate lived experience in the process. So either with the writing of the actual RFP itself and or creating of scoring panels, doing that sort of thing, is a way to incorporate equity into the process. Being real clear about the funding priorities and sources is another way to do that, because we don't want to waste people's time. Our service providers, particularly the small ones, are very busy. And so if they're writing a big old grant application for things that they're actually not eligible for, that's just not great for many reasons. Having longer submission timelines, again, so the smaller providers who are typically serving more marginalized communities or are staffed by marginalized communities on their own and have less access to resources, they have the time, a little bit more time to be able to get into the pool of competition. We build into our rubrics and our assessments of applications, diversity and representation. So folks who are reviewing applications are hopefully representing communities where those services will eventually be provided in, and they're assessing our applicants on how they're doing that in their work as well. And moving quickly, our service providers wait a long time to get reimbursed for their funds a lot of times because government processes are slow. And so what is an equitable move for us to be moving quickly so that we can make sure that they're reimbursed in a more timely way, that we're not sitting on a pile of money that can be used for really good services right now because it's, you know, held up in bureaucracy. And so that folks can know in a more quick timeline. It might not seem quick, but we released the RFP in October, and we're going to be making recommendations to the board in March, or the Family Income Services Committee in March. And that gives providers a little bit more time when they're talking about budgets that are for next fiscal year to say, okay, we're going to have this in our budget. We can start planning around that. And we can start thinking about how to message these services and so on. Or the opposite of, oh, we didn't get this funding. We need to understand how to update our budget and make sure we're planning around that. I think the last slide here is kind of next steps. Like I said, very high overview. There's a lot of detail and nuance to every single individual funding cycle. But I pointed folks to where you can find our RFPs and whatnot on our website. We provide updates on funding at every Council on Homelessness meeting. So some of y'all get to hear this every meeting. And we'll be coming to this group as the Equity Committee to provide input on our funding applications. Sorry, been talking all day. So that's what we see as kind of next steps, and really wanted just again to make sure everybody was starting from the same baseline of like, what do we talk about when we talk about funding? Thank you, Jamie, for being on it in the chat. Any questions before I move on to the next part of the presentation? Anybody in the online world, feel free to chime in if you've got questions. Or feedback. Was this helpful?
Yes.
So this is Nicole. This is very helpful. I even got more excited that I joined this committee. But so pretty much you guys will bring information here for any applications that you guys are applying for us to kind of have a conversation
We'll
about.
submit any applications because sometimes the timelines just don't work out.
Okay.
It's going to try to be our practice to be getting more input from this committee, from more people when we're applying for big ticket items like the COC competition, like our hack dollars, those big ticket items that influence our system.
Awesome. No, the information you're giving is great. It's amazing. Thank you.
The next slide. I will transition us
It's the same show.
to the next agenda item. And you are hearing from me today instead of Shelby, who is our COC administrator, because she's out of the office. But last year, for those of you who are here, we brought to you the Continuum Care Participant Satisfaction Survey for feedback. And so we're doing that again this year to see how we can better improve it. If you go to the next slide. For folks who don't know, we conduct a survey annually of people who are accessing these 7 types of services within our COC: prevention, rapid exit, core street outreach, our care centers, our shelters and transitional living programs, rapid rehousing, and permanent supportive housing.
I'll mention, those program models are in your packet to expect.
Oh, that's probably why I got.
Oh, yeah.
That's why it's ginormous. Yes, exactly.
It's big. I was reading those.
Sorry about
You're like,
that. A little bit more background. So the survey was created in 2023. That was the first year we distributed it. And we convened a work group made up of 6 people of lived experience with homelessness, kind of from a wide variety. So we had folks who had experienced homelessness with family, in a family setting. We had individual adults, seniors, all that. And last year we came to this committee and y'all provided input on, hey, there should be a demographic question section at the end of the survey, optional, so people can share a little bit more about who they are, and we can see if there are any differences in experiences across age, gender, race, etc. So that was really helpful to bring to this group with that. So the next slide. Some ways that we've tried to incorporate equity within the design of the survey is that it's provided in paper or electronic form. So some folks might not be comfortable with technology, they can access it in paper, and some folks might want to do it on their own, not necessarily with a service provider or going to a physical location to pick up a paper form, so they can do it electronically. We have the paper form in English and in Spanish, so there are 2 most common languages in the county, and the electronic version is able to incorporate some help from Google in translating to 6 different languages. So it's got a wide variety of languages. We designed the questions to target a 5th grade reading level, to make it as accessible and plain spoken as possible. We added those demographic questions. And we had a mix of Likert scale, meaning it's a 1 to 5, kind of very happy to very unhappy sort of scale, and open-ended questions so people could share a little bit more qualitative how they're feeling with the services they're receiving. We also encourage folks to provide incentives for completing the survey and compensate people for the time that they spend. There's a little asterisk there because we don't have the funding necessarily to make it a widespread, consistent practice. But a lot of our providers will say, hey, we're going to be doing the survey over lunch, and we'll have a raffle to whoever completes it can get, entered into that raffle for a gift card, that sort of thing. So there's definitely room for improvement in that area, but we've tried to encourage folks to provide incentives for that. So the next slide. So far, here's how the process has gone. In January, we brought the survey to the Youth Action Board to review and provide feedback, and they did a really great job. And the feedback has been incorporated, and we're bringing it to you all for review in February. Once we get all the feedback that we're seeking incorporated, we're going to be providing training to our providers who are going to be distributing this survey by the end of the month. And we'll be using the month of March for our providers to be collecting the surveys from participants. We'll take probably April and May to analyze the survey. We got about 500, 600 or so surveys last year. So the more paper surveys we get, the longer that analysis process takes, because that means data entry. But we're hoping to keep those numbers high. And we'll share those results back to all of our stakeholders who have provided this really critical input. So we'll be going back to the YAB, to Oversight Committee, to PATH, and to Equity, probably sometime in the late spring, early summer. Of note, the survey actually only has 2 required questions. How long have you been accessing services and where did you hear about services? And the reason these are the 2 required questions is because a lot of our service providers actually already have a survey, but they're asking participants for their specific services. What is it, how their experience is. And because we're providing the survey across 7 different models, it's hard to come up with a long list of questions that are applicable to street outreach versus permanent support housing. So we keep it real short. If you go to the next slide, there are also optional questions that people can incorporate into the survey that have to deal with their experience with staff, physical location of services, open-ended narrative questions, and demographic questions. So if these aren't already incorporated into a provider's survey, we really encourage them to adopt them. And if you go to the next slide, just want to highlight some of the feedback we got from the app. We had questions around making sure that in the staff training, we can incorporate more feedback on whether or not participants feel like staff are receiving adequate training and are knowledgeable about the resources in the community. We could incorporate more on confidentiality and how participants are feeling safe with staff that they're interacting with. And adding more open-ended questions to each question. So right now we have very few spots, I think 1 or 2 open-ended questions within the survey for people to say whatever else they want to share with us, essentially. Some of the feedback was, that should happen after every question. I get the reasoning, but what that actually ends up doing in most surveys is just making it really long and discouraging people from taking it. Because if they see a 3-page survey, even though all the questions are optional, they're way less likely to take it than a 1-page survey. So we probably will not, we won't be adopting that recommendation, but we want to be able to, in our training, encourage staff who are helping folks complete the survey to really highlight the open-ended questions of like, you can share whatever information you want to share there. There's space for you here, whatever you want to share. If you go to the next slide, I want to open up to y'all. How questions are developing. I see a hand from Nicole already. Thank you. Take it away, Nicole.
I'm probably jumping the gun to another day. I appreciate all the information that you gave me. Sorry if it's loud. I'm in the office. What processes are in place or have there been processes in place to evaluate how providers are actually conducting the survey?
Oh, that's a great question. As in,
because I know we're saying we're giving them staff training on how, the survey, but after that, are we actually ever going back to see how they're actually doing this survey?
Not in a systemized way where we're asking participants, how did the staff, did you feel comfortable answering the survey? Like, we're not doing that kind of additional layer of evaluation. But we do hear from our teams of like, hey, we're having a hard time with like this section of the survey, or we didn't get a lot of people being responsive to our phone calls, that sort of thing that we incorporate into training and try and provide tips and strategies to like get more of the surveys. And Shelby monitors throughout the survey period, like, oh, I haven't gotten that many survey responses from prevention. Let me call up the prevention provider and see, hey, how's it going? What are the barriers? What's going on? And that's just an example, and not picking on our prevention providers. I made that up.
And I forget, like people are being handed basically a device where they're doing it, or the staff asking the questions and they're telling, because obviously if they have
It'll depend.
Member.
So folks can just take the survey on their own, no staff support. I know our core teams probably can, like, we'll turn the iPad over and say, here's the survey if you want to take it, et cetera, and so on. But some folks do want support in like understanding the questions and reading through it and all of that. So sometimes they will do kind of person to person completing the survey together.
Okay,
So
no, go ahead, I'm sorry.
No, you're good.
No, I was putting back on my old school provider hat when I had to do this before. That's why I was asking. And sometimes providers they do run into difficulties in reference to getting the survey out. So just thinking of just wondering from our end, that support for them to be able to conduct these surveys to bring back the proper data. Just being a provider before, I'm aware of some of the complications of getting the survey done. That's why I was wondering.
If you got any tips or tricks, Shelby's email's on the slide.
Yeah, I'll wait till when we get to that point. I was just excited about the whole thing. Go ahead.
What about other folks? Any thoughts or and especially from our providers in the room, virtually or physically? Any experiences from doing the survey over the past couple of years that you want to share? Leslie, I see you.
Hi, yep. I have mentioned this in the past, but it still is worth talking about again. What we experienced at Trinity Center was that people might be touching our system of care in multiple places. And even though we all understand the names for our different program models, our participants didn't always. So it got a little confusing. They would check Trinity Center and Care and Core and so then it wasn't clear what the answers were. So if there's a way that we can help the provider of the specific program model only make it possible for the person to answer questions related to, yes, this is a care center, your care center. So it creates less of that confusion. So
That is something that I forgot to mention. So if you all remember, we have those 2 required questions. Last year we had 3, and that's the question that Leslie mentioned of which services are you accessing? Is it core? Is it care? Is it whatever? And this year, instead of adding that as a required question, we're having our service providers, the folks who are delivering the services, fill that in. So they'll be making that distinction because to Leslie's point, yeah, people said, well, I access all like these 3 different kinds of services, but we weren't sure, like, are your responses about care or about prevention or about, you know, which of the services you checked off? So this will help us get a better sense of what people's experiences are with that particular service. Thank you, Leslie.
sounds good. Thanks.
One more time.
Do we test it before we actually give it to people? So we give it to like 10 people and say, hey, take a look at it. We're gonna get feedback. And then you give it out.
So that's what we did kind of year 1 with our group of lived experience providers is they gave us kind of input and we developed it and tested it with them. And then we've taken feedback over the years from folks who have been delivering the survey of like, this is how it's gone. Here's how we refined the language and made it more simple for people. But we don't do that every year. Or yeah, you can think, Jamie, or you just give me eyes? Nope, okay. Thank you. If you want to email Shelby and let her know that I covered the slide. Just kidding. Just kidding. She will be back with further updates on the data tracking survey, and I will turn it back to Alex.
I think Janelle is going to walk us through the first couple of slides in this section, and then Mark will guide us through the dashboard, like some examples of the dashboard. So Janelle, I'll pass it to you.
Hey, hello, everyone. I am going to talk about the framework for the Equity Dashboard Project, which we are all here for today. Next slide, please. Okay, so this is an overview just to ground us in the goal for the project. I'll talk about what is a data dashboard, provide context about the data that we are looking at to measure equitable service delivery. And we'll look at some examples that we're currently collecting in our community. Then I'll hand it over to Homebase, who will take it to some examples in other communities and how they are collecting equity data. And then we'll go into some discussion and next steps. Okay, so what is a data dashboard? So data dashboards are tools that track and visualize data to make the information easier to understand. This can help the committee and COC better track progress, identify trends, and inform discussions and next steps. Data dashboards are often used in COCs to present key performance indicators, not just related to equity. So an example I like to give about a data dashboard is our weather channel, right? So we see the weather channel, and what that is a data dashboard. When you have your like 10-day forecast, what that truly is like 10 big tile, we call it big tile, big number tiles, right? So it's an opportunity to get the information without having to do that predictive modeling yourself. So it's very clear and direct, and you know the weather without having to do that math. So that's our goal. Okay, next slide, please. Okay. A priority for the 2025 Equity Committee is to monitor equity-related metrics in the COC. And we're going to develop an equity dashboard. And this is a project that we're going to work on over the course of the year. So today we're going to start with getting some ideas, starting to look at the data that we are already collecting, and then get some ideas about what we could be collecting from other communities. Next slide. Thank you. Okay, so what I won't do again is attach our big program model document. You realize it will be uploaded, but I wanted to just mention that we are collecting equity data as outlined in our performance model, the continuum of care, program models, and performance standards. So that's the big document there. I listed the purpose of the standards here, but I really wanted to highlight the third bullet point. So one of the goals of the standards are to establish clear performance expectations, measures, and benchmarks. So those exist in that document already. And our goal for this committee is to visualize the COC performance for equity benchmarks. So we want to display it so that it's clear, just like our weather app. People can look at it directly and know exactly what we're talking about when we're talking about equity performance in the COC. Next slide, please. Okay, so I pulled out the definitions of the equity measures from the program models. So the equity measures that exist in the program models, there are two. One is specific to service delivery, so it's going to vary depending on the program model. Like Jamie mentioned, you know, the measurements that we do for street outreach are going to be completely different from the measures that we do for permanent supportive housing. So equity measure one is about service delivery. And on the slide are just some general examples of how equitable service delivery can look across the system. Equity measure two is about agency leadership, agency leadership and staff. Are we hiring the folks, are people working in our system that reflect the population that we serve? So those are the two main equity measures that you'll see threaded throughout our dashboards. So now I'm actually going to share my screen because we do have, as I mentioned, we are collecting this data already. So give me just one moment to pull that up.
I just made you a co-host just to make sure you can get in.
Thank you. Funny, there's like so much on my screen trying to share this. It's very clear up there. It does not look clear here. Here are, this is like a 10 or so page document for those who have looked at the attachment of what we are currently collecting in HMIS. So these program performance dashboards already exist. And they're related to our program models. And I believe the agency administrators of each agency have to run these performance dashboards quarterly. And we haven't done much yet with the equity section. So this year we are taking that on. I tried to consolidate this document a little bit because we are collecting some of the data, like it's the same measures across each program model. I think we have 6 total performance dashboards to reflect our service models. So across all program models, we are currently collecting data about referral status by race and ethnicity. So so if somebody is referred, if you know, a group of people are referred to a program, are they being accepted at the same rate as other racial groups? So we are looking at that, and that's across all program models.
Zoom in a little bit.
Oh, yes. I need glasses now. Thank you. Is that better?
Yeah.
More?
But also, it's in the packet, so I can, let me see, I'll find it.
I should mention while we're on this slide, since this is on our performance dashboard, most of these metrics are by program because it's for agencies to know how their programs are doing. So what our end goal is to reflect data across the COC. So just something to think about. This is at program level, but we want to display something at the entire COC. So yes, here we have like percentage of referrals accepted, denied, and my Zoom is in the way, pending. Okay. Okay, next we have total served by agencies. So this is not by program, this is by agencies. So agencies can know the racial breakdown of participants in all of their programs in their agency. And we do the same thing for gender. Also termination reasons. So this is threaded throughout the program models. We want to make sure that one group is not being terminated more than another group for, bad behavior or, whatever reason they are exiting the program. We're keeping an eye on that to make sure that it is equitable. And then we do have some, I included them in here, even though it's not, doesn't include prevention and rapid exit, but benefits. So benefits like non-cash benefits, so SNAP, WIC, those kinds of things. Are people retaining those and health insurance? So these are the data that we are collecting across all program models and in assessing for equitable service delivery. So going further down, I included the page number for some of the specific metrics. So if you wanted to look at it, you can see it called out in that in the big packet of performance standards to find exactly where those live. But we do have, we are collecting data about retention for permanent supportive housing. How long are people staying housed? Average time to move in. So length of time it takes from someone being homeless to actually having a move-in date and moving into housing. Rapid rehousing, we have some of the same, the average time to move in by race and ethnicity. Exits we have to permanent housing and households who are still housed after 6 months because rapid rehousing, we have some folks that return. We have some recidivism there and we're keeping an eye on that and we are making sure that it is equitable, that one group isn't returning more than the other.
When you say returning, what do you mean by that?
Oh, that's a great question. Making contact with the system again in any way. So they may have exited to a permanent destination, permanent housing.
And then they can move.
Basically, they come once again.
Yeah, okay.
Was there a big question or something about this? To some, I mean, why is it emphasized, you know what I mean, what?
That particular piece about people returning.
Or different care.
Uh-huh.
I mean, it was, are we trying to make sure that we're being fair, or was there a question about us not? And that's why we want all this data.
Yeah.
Question, yeah.
So Mark is asking, so Leanna's asked us, was there a question about equity in our community? Like, why did we start to slice and dice a lot of this measurements? Because we clearly put a lot of work into this. And the way I will say it is, we know that there are inequities in the benefit prop system. We know that Black folks Native American, Indigenous folks, Native Hawaiian folks are way overrepresented. You know, by like 4 times the general population, 9 times the general population. We know that there is inequity in our system. And what we try to do with our performance models when they were being developed back in 2022 was look at the things we can control, because there's so many systemic societal reasons that that inequity is there. But there are things like, are providers discharging people at different rates because there's implicit bias or explicit bias happening? Let's keep an eye on it. Just because we're measuring it doesn't mean that there's an issue that we've identified. When you look at permanent housing outcomes, there's a lot of groups that are seeing equitable experiences, but it's for us to be able to see, are we making progress on that kind of big ticket number by working on the things that are within our sphere of influence, so to say? And are we giving this information to our providers so they are going in with informed eyes as well? Does that help?
Yeah,
Okay.
yeah. I mean, if we had no question of their demographics, you know, like whether you were American Indian or whether you were Black or whether you're white, you know, just erase that completely off the questionnaire. You know what I mean? Off the, would that, I mean, how different would that, you know, be if they didn't know the race, the gender of their participant, you know, for the providers?
That is an interesting question. And what feedback we often get from our providers, particular from housing providers, so rapid rehousing, from supportive housing, is that, well, you know, you guys are the ones sending us referrals, which fair enough. But it doesn't serve us to remove that information, because if it does become an issue, we wouldn't know if that information wasn't there. Same with gender and sexual orientation. Like, we know we are underserving certain groups, and there's a lot of reasons why, so it's in their best interest to track it.
Gotcha.
And I'll add, Leanne, I mean, your question is really interesting because there have actually been studies that do the opposite, where they have exactly the same resume, for example, going out. And if there are cues about race or ethnicity or or gender, then there's really different experiences. And so like our clients are interacting with their providers, and like there's not a way to sort of mask that. But to Jamie's point, if we don't gather the data, and this is why like it freaks me out what's happening at the federal level, if we aren't gathering the data, then we won't actually ever be able to know what's happening. And I'll say this, like, I don't know if you're familiar with this idea of like implicit versus explicit bias. Like a lot of times people they don't even know, and this happens with doctors, it happens all the time. And so the only way that people know that they're not acting equitably sometimes is the data. Because all of us, if you ask us, you'd be like, I treat everyone fairly.
Yeah. I just went through that.
And so it's the data, and so then we can go to the providers and say, like, we're not saying you're bad, we're not saying you're wrong, we're just saying like, this is what the numbers are showing us. So we need to figure out what will we do about this?
Right.
And it's not even necessarily what will you as a person or you as a person, it's like, what can we build in to correct for this?
Or I was doing some of those tests on there and I didn't even know. I'm like, I didn't even, you know, and it was, okay. So it's like some things we don't
And
know happening.
we're going through this to generate ideas of what we want to see for our COC. And what I'm hearing is maybe it would be helpful to have an average that's not broken out by race and maybe race underneath. So you can see, you know, in comparison, everyone, and then if anybody is, you know, completely, you know, just, you know, so far greater than the average of everyone, you can see that group. So it's something that if we are interested as an equity committee, we could. So I call that out because I think that was under rapid rehousing. And I should mention, just because something is under one particular program model doesn't mean we can't do it for the COC. It just means that we have to think about how we are looking at move-ins differently. So in rapid exit, we have average lengths of time to exit to permanent or temporary destinations. These are in development, but they are there, and I wanted to show them. So households that receive financial assistance, and households with follow-up attempt post-housing exit. So people who are actually being connected with after they exit the program. As you see, we don't have the race there yet, like I said, in development, but they are equity measures that are in our program models that we are looking at. Let's see. Shelter exits to permanent and temporary. Oh, Nicole, I see your hand.
Yes, and I can be completely overthinking, but I'm gonna ask the question anyway if it's silly. Are we, as we're looking at this data, and is it going too far to look at, as we're looking into equity and looking into race and those different things, are we looking into other issues that, how can I say it, swear for it, barriers that other individual may be facing within that program? Like if they had mental health or if they had something. I know the homeless focus on the individual as a whole, but do we go deeper than that or just race, age, gender? Like if they're in the do we go deeper than that or we just stop here?
The program models, to my understanding, were focused on racial equity.
Okay, okay.
You have, a lot of data that we can measure, so that's what we honed in on. Doesn't mean that we can't look at, other barriers in the future, but right now we're looking at racial.
Okay.
And Nicole, I think to your question, a lot of our annual report information will dive into that, and that's something we could look at, is how we put an intersectional lens to our annual report data. But that individual kind of person by person conversation happens more at the program level, where I know, our shelter providers are running these dashboards and they're having conversations with their staff saying, hey, like, Mr. So-and-so, he's got X, Y, and Z, and how are we wrapping around to provide support?
Thank you.
And just to clarify what you were asking, Nicole, are you asking to see if there are particular races that may be at higher risk for things like mental health issues or addiction issues, and because of that, we're seeing an inequity in terms of services, so then we aren't able, if we're not able to name those barriers, then it looks like solely a racial thing, but it's a little bit more layered than that. Is that what you're asking that?
Yes, yes.
Yeah, so say that there's a particular race that may, I'm Hispanic, right? So they're saying Hispanics are more at risk for heroin usage, I mean, I don't know that that's true or not. And so we're seeing at a disproportionate race that Hispanics are exiting programs or being terminated or leaving. And then we're saying, hey, you guys are being inequitable, but there's a deeper issue to why the Hispanic group is being, so the data could be off or not whole. I think that's a great question.
Yeah. Thank you for that. Thank you for elaborating on that. I appreciate it.
Sorry, Janelle, if I'm butting in too much. I think that's the part 2 of the conversation. Like, are we seeing inequities happening? And then, yeah, we are. What is the underlying reason for that? And some of the things we see in data is that we underserve folks who are Hispanic, but like we don't see them as much as we would expect to, given all the other factors. And so the equity committee worked on developing more outreach materials, because a lot of times the feedback we got from kind of digging deeper was, I don't feel comfortable. I don't know what's going to happen. It's not in my language. I'm worried about my immigration status being questioned. And so we tried to develop materials and like FAQs to help address some of those fears, so folks would feel more welcome coming to the system.
Thank you. That's helpful. It's a helpful answer. Yeah.
So in our care centers, we have total served with a case manager, total exits, total housed by race and ethnicity. So we're also looking at that. And for core, households that have gone 120 days without a service. And when we look at households, we're looking at the race of the head of household. Just to clarify that. And total served for prevention and diversion, exits to housing, and retention status. So households that receive a 1-year follow-up, how are they doing? Do they still need assistance? But I provided this here as an example just to get the thoughts going of what we are currently collecting and what do we want to see at the COC level. So most of this is program level data, but we can report on it for the COC. And I'll pause for any questions about the data that we're currently collecting. Thank you. Okay, and now I will pass it over to Mark, who will talk about data being collected in other communities for other examples.
Thanks, Janelle. Can everybody hear me okay?
Yep. Yes.
Awesome. I'm going to share my screen. I think this slide, Janelle, it was a holdover from, or it's a summary of the measures that you were just talking about. Is that correct?
Yes. Mm-hmm.
Awesome. Yeah, and thank you, Janelle, for going over the data currently being collected by the COC. Just want to let folks know if this is new to you, if any of this is confusing, you're not alone. And I think that's part of why this dashboard project is going to be a process over the next couple of meetings. We want folks to ask questions. If you're not understanding something, to share your ideas as we figure out what the dashboard is going to look like, what's going to be most helpful for this committee and for the COC as it relates to trying to look at, measure equity and disparities, and of course, be able to make progress and advance racial equity within the system. So I'm going to actually talk about some dashboard examples from communities just to give you all an idea of what it could look like. So this is a dashboard from Monterey San Benito County. They have what they call a racial disparities dashboard. It has some of the indicators that the data indicators that Janelle was just going over. And what I'll do is just kind of talk briefly about it. Admittedly, I'm not, I don't work in these communities with these specific projects. So these are just examples we pulled from different communities we work in, but may have other staff working on these projects, or we just pulled it from other general research we've done across COCs from other communities. I just wanted to give you all a couple examples to frame up some discussion that we're going to have a little bit around this project. So again, this is from Monterey / San Benito counties. So this is a COC that covers 2 different counties, and it's in the Bay Area. And they look at these indicators within a specific time period. I don't remember what it is here, but I imagine it's probably either a quarter or a 6-month period, or maybe even a year. But they have total engagement within their COC, average length of time. I think that's, for people to getting services, total exits to permanent housing, total exits to temporary housing, total returns to homelessness. And then you see some bar graphs here, engagement with COC providers compared to 2020 census data. So you see kind of the overrepresentation of certain racial and ethnic demographics as it relates to their share of the overall population in this community. Then you see exits to permanent housing. So this is, again, just as one example of a dashboard. We came across many that looks maybe as simple or similar to this, and we've come across dashboards that have pages of data visuals. So we tried to find the ones that we could share easily in these slides. So this is Monterey San Benito County. Again, just maybe think about, because we are going to have discussion later, think about things that are standing out to you, questions you may have as I go through these few examples. Next one is Bucks County in Pennsylvania. So they call it recidivism, but it's essentially returns to homelessness. But they have a couple of visuals that this is one of the main ones that they use as part of their dashboard. So they show, again, breakdown of different races and ethnic groups. And then you could toggle, there's actually interactive, you could toggle between gender, age group, household type. And you see in different colors represented there, whether there was no return, whether they returned within 6 to 12 months, or they returned in less than 6 months. And then this is actually from this community, from Contra Costa, but this is the PATH Committee. PATH Committee, if you're not familiar with it, it's a committee of the Council on Homelessness. Some of you may be members of this committee. They're focused on unsheltered homelessness. And so they created a dashboard that's focused on the issue of unsheltered homelessness. So in this example, they're looking at data from a particular quarter in 2022 or 2023. And it looks at several different indicators here, and there's a little bit more kind of a like an infographic type of look to it. But yeah, it looks at various indicators here, but I won't go over each one because this one again is focused on unsheltered homelessness, not necessarily directly related to some of the data indicators that we've been talking about. But again, there's probably some correlation if there was interest in showing perhaps racial disparities as it relates to unsheltered homelessness and people being served. Anything else from, did I miss anything on this H3 that you wanted to say about this dashboard?
Just that this is an example from our older dashboard. We've updated it since we were using this one, because this one actually shared a little bit too much information, where people would be like, well, I'm getting like all these numbers thrown at me, but it doesn't really give me like that high level view that I'm hoping for out of the dashboard. So we refined it since even this iteration. And you're all welcome to join us at the PATH Committee meeting next Thursday, I believe, 9:30 to 11.
Thanks, Jamie. Love the plug. Any questions about any of these 3 dashboards? Okay, not seeing any hands virtually.
So the second dashboard, I mean, that's an example of something that is too
much?
Yeah,
It's hard to read.
yeah, to break it. Yeah, it got me, even though I'm
Yeah.
kind of like,
A little overwhelming, just
Yeah.
seeing all that.
yeah. Yeah. So I was just.
Good.
Yeah, thanks for the feedback for sure. And again, this is just on the slide, but this one's interactive, so there's a lot of things you could do in terms of toggling between different filters. So you've seen a couple dashboard examples. We've talked about what the dashboard project overall is meant to kind of do. You've learned at least a little bit more about some of the metrics, the data that's currently being collected within the COC. Today is really meant to kickstart this conversation, this project on the data dashboard. We don't have to, I don't think, make any final decisions about anything here. This will be another agenda item on your next meeting agenda in March. But we wanted to just get you thinking about, some of the important aspects of what the data dashboard project can do within this committee. So I just have some discussion questions here. We don't have to go through them in order, but I'll just read them out loud. And if you're, prompted to speak to any of these, I invite you to. We just want to start some conversation and figure out what you're thinking, what you're hoping for, what you need in order for us to move this project forward. So between this meeting and the next meeting, we'll have a month that, if staff need to put together some things that you can react to for the next meeting, we could do that. So the questions on here are: what struck you about the dashboard examples? What was most helpful? I can always go back to those slides if you want to see them. What are your goals for an equity dashboard? Who are the audiences? Like who should be looking at the equity dashboard? What kinds of things do you think those audiences are most interested in understanding, what tells the best story, gives the best indication of where this COC is at in terms of advancing racial equity. And then third, which metrics do you think best illustrate racial disparities within the system? What questions do you have about data? And then what other information or resources do you need to inform this project? So sorry, I just threw a bunch of questions at you, but really just invite you to respond to any of them or share any other thoughts or questions you may have about this. Go for it, Nicole.
So I appreciate your questions, especially 1 and 2, because that's exactly where I was going to go. So as I was looking at the examples that you provided, the first thing that came to me was our audience, because you don't have to go back, but I think it was the second one. I don't know whose dashboard that was. Started with a B, I think. Oh man.
Bucks County, Pennsylvania.
So at first that one caught my attention, and then you went over to the path one, and I was like, oh yes, that's great, because it all depends on who's going to be looking at it. You know, the other two are really high level, which may be hard for some people to read. And then the other one was like, it made me think of 211, right? So I guess for my question, for me to provide assistance, when I provide assistance, but what I need is who is our audience and who are we building this for is going to make a determination on how we want the dashboard to look. If there's providers, is it the community, to make sure they understand what they're reading? But I really appreciate the examples. But my last one that I put a star next to was the path one, because it was easier. I'm thinking of just a community member that don't know the metrics and how to read all those graphs. They'll just be able to click and read it. But again, it goes to who's our audience.
Yeah, thanks, Nicole. Yeah, absolutely. Janelle covered it in one of the first slides of this particular section, was just like, what is the purpose or the goal of the overall dashboard? And there could be sub goals and you all can add to that. But, you know, one of them is just simply that a dashboard is meant to easily communicate things that, you know, otherwise are complex or hard for people to comprehend quickly. And so if the dashboard doesn't do that, if it can't communicate clearly, you know, what the few data indicators are saying within the visual, then it probably is not doing its job. Juno, I see your hand raised.
And just piggybacking off of that, not if you know, if it is, the goal is to be a tool to clearly communicate this data, then yeah, it does wrap us back around to then who are we communicating it to? Because data, I will say, is not the best way to, for example, and show a necessity or a need to the general community at large, I don't think, right? And like, especially for like some of my peers, like this data is interesting, but that's it, right? It's like they might not even lined up with their lived experience because of like, we have all this accumulation of all this data from all these places, whereas like a single individual might just see what the people they see that day or the people they interact with. So I think that's a really, really good question of who is this supposed to be seen by? And like, I think earlier it was Leanne who was saying like that this is like, this part's a little bit too much. Like, you know, I think that's highlighting a key thing. Like if we want like this to be a community informing process, then maybe there needs to be separate like reports or separate dashboards, or I'm not sure how the best to do it. I don't have the expertise there, but like reaching to different audience requires a different sort of touch. And I will say that like, yeah, when it comes to, so from my experience, when it comes to like trying to talk about this stuff in community, the data is not really the way to go. Like, it's more like, you know, how, like, you can bring in the data, but first it's like highlight, you know, community experiences and then be like, yes, and like, this is what the data supports that, or this is the data we have shows that you're correct, you know, that there is a need there, or something along those lines.
Thanks, Juno. Yeah, our audiences are definitely important to kind of define, and that's going to be part of, you know, what is going to inform the design of the thing that we're building. And even before that, I think goals is going to be key in terms of defining who those audiences are. I see another hand raised, Jamie.
All right, so I think one way to reframe the audience question is to think about how is this dashboard going to help you as the equity committee and participants in the work group meet your purpose of increasing awareness, community dialogue, and leading the concrete actions to achieve equity throughout the system of care. So how is this data going to help you make those decisions on like, okay, what kind of awareness do we need to be increasing? who do we need to be bringing into dialogue, and what kind of action steps can we develop based on what we see? That could be one way. And I think also to Juno's point, we've really heard and I think done some work on incorporating, like, how do we get that qualitative narrative experience built into it so that they're working in harmony? Because to Juno's point, sometimes people look at numbers and go, yeah, this is just like numbers on a page. That doesn't mean anything to me. And then on the other hand, when they hear a story, they'll be like, but that's just one person. Doesn't really reflect everybody. But when they work in partnership, when you say, here's this person's experience, and actually this is a pretty common experience in our community, how do we address it? That can work really powerfully.
Love that. Thanks, Jamie. I see Juno and Nicole's hands, but I'm gonna just, because you've shared already, let me just pause to see if anybody else wants to join the discussion.
If I can just say, I mean, I know I'm not part of the committee, but if I can just say that what was most helpful was actually one of Jamie's comments that said, so we're not here to find all the information, but we're here to create something that helps us know, okay, well, let's dig deeper into this particular people group that may be underserved. Is there an underlying issue? And I think that that was actually the most helpful thing, because then it's not, we're not trying to solve how can we make sure that everything is represented, but how can we make this general enough to let us know where we need to dig? Thanks, Josie.
Yeah, thanks, Josie. Any other comments before I go back to Juno and then Nicole? Okay, Juno, I saw you lower your hand. Do you still want to make a comment?
Yeah. I mean, we're still, we're thinking sort of brainstorming, discussion kind of stuff. I think that bring us to number 3, and a little bit of what like Leanne was talking about earlier as well about, and we kind of touched on it about like looking at the data that's not there and using that as comparison tools. I guess I don't know, I'm not a data brain as some of the other people in the room, so I don't know exactly what kind of tools we would use to like collect and see that kind of data. But I know that like whenever these conversations come up, I highlight and will highlight, the my experiences in system, and like, being a trans person, and like knowing that like we have so little data on trans people like in systems of care, that it's almost like, it's such a small percentage that there's like very little support and focus on that sort of aspect. And like, it's so, I don't know what best would highlight that. And like, I think piggybacking off the racial disparity part, that I think that the intersections between like gender and race, for example, are the specificity of that data might be hard to utilize everywhere, but could probably reveal a lot about like what we're missing. And I think we've done a good job in the past kind of collecting some of that data, but I still feel like there's a piece missing where like, I know for HUD, like when we report out, it's like, I look at the reports and I'm like, yeah, like trans people are apparently like less than 1% of the people who are being served. I'm like, that's not lining up with my experiences that I see. Like, I see trans and non-binary people on the street, and I see them scared to like report themselves, So yeah, I guess like the intersections there, I think, can highlight a lot. I just don't know what the best approach is.
Thanks for uplifting that, Jono. I think you're right. We know that that's data that's underreported, and just knowing that helps us dig into why folks aren't feeling comfortable coming to our services or disclosing their gender identity or sexual orientation to us, to understand how they're experiencing things differently. Because I do think a lot of times, you're right, folks are scared to say, this is who I am, when they're just meeting someone at an intake that they don't necessarily have a relationship with. So how do we build on that?
Especially to be undocumented or then that's. Yeah.
Nicole?
two parts. So just to piggyback off of Juno, I definitely agree with that. And that was one of the things that I've said in the past in reference to those that are just as involved and incarcerated. And I appreciate that she just brought up undocumented. How do we get people to feel more comfortable with speaking up? What I've learned with being part of the Council of Homelessness is a lot of the data that we get is self-told, right? So if they don't feel comfortable, then how is our data accurate? So how do we get the people in the community to be more unafraid to share? But I raised my hand because I really liked what Jamie said, and it's probably too late, but she had said some questions. So I'm gonna have to go back to the video. And I was trying to get those questions down because they would help. I felt like they would be very helpful in a lot of us that are new here and our thinking process, and they were awesome. So I don't know if she remembers what she said, but
Let's see how good my memory is. I think I said, how does this dashboard help you meet the purpose of the committee, which is to raise awareness, create community dialogue, and create concrete action steps. So how's the data that you're going to get out of this dashboard going to help you meet that as a committee and as stakeholders who are interested in this committee's work? How are y'all going to be able to use this data to meet those goals?
Yeah, let's spend some time here. So I put up the purpose. Sorry for the scrolling back on slides. I didn't realize how far it was. So this is the purpose of the committee overall, and open to thoughts on how this dashboard helps this committee achieve this purpose. Janelle, I see your hand raised.
So I like the unpopular dashboard. I like I like the Bucks County dashboard a lot because I think it is actionable. I think it tells a story of when someone might become vulnerable, or when a racial group might become vulnerable and may return to homelessness. So it's a recidivism dashboard, and I believe it was at 6 months. So you can see that some groups were more likely to return at 6 months than others. And I think increasing that awareness and a community dialogue, I think, I think it does tell a story. But if I'm the only person hearing that story, it's not that useful. So maybe I like the recidivism piece of it and the ability to say, hey, we know that this group is more likely to return before 6 months. And then maybe we can actually do something there.
it's okay if I jump in, Mark? Is it okay?
Yeah.
No, I was gonna say that was the first one that I seen that I liked, but that's because we have data mindset, right? So I had to keep that in the back of my mind of who was reading it, because that one stood out to me too. But then I don't, depending on who's reading it, they may not be able to read it the way we do. So I went to the easy one, but that was the one I liked. That was first, then PATH was second.
I will say that's a big focus of a lot of our funders too. Like HUD in the state, their system performance measures, the thing that's looking across our system is asking who's returning within 6 months, who's returning within 2 years. Because when you permanently house somebody, we want to make sure they stay permanently housed. That's the whole goal of permanent housing. Sometimes things happen outside of anybody's control, or people are going to lose housing again. But at what level is that acceptable versus not?
I say, okay, although this, it gives you the lowest exit rates for a month. You know what I mean? Maybe it's just me, but doesn't give an end. I just, maybe it's because I can't see it very well, but I'm looking at it, it's just, me is who I am, I feel that I could, that I could decipher between things, if I had a question about this one, but it doesn't. Numbers are, give me a start and give me an end number, and then I can see, instead of that's just, for me, I'm not a HUD or, whoever, but yeah, just that, you know, there's 100%, you know, started, and then there's only 42% left of Asian. You know what I mean? Something like to that, you know, then you go, okay, why in this, are they not understanding, or they're not, their language is not clear, and, you know, our whatever applications, or, you know, whatever the questions to remain into the system, you know, like, or what are they not doing to keep their qualifications, you know?
It's not enough of the story behind it.
Yeah, then you'd have to go, I guess, go to that after you find out that there's.
Mark, will you go to the Monterey example? And you probably see your hand up, but I wanted to see if, Monterey one, I think, is doing a little bit of what you're asking for, like, how do we know we're making progress? Like, the
Right.
numbers
Yeah.
about like what we should be at. Whereas this one, it has like that line saying, if it were perfectly in line with the general population, this is where the number would be.
Right.
So you can see how far, one way or another.
Yeah, which
a
is
particular group
amazing,
is.
yeah.
How, what were you, wanting to have?
I was kind of gonna say that, it was, just that I do like what you said about like the Bucks County one, like I do like a lot of parts of it. So it's just at face value, when you first see it, it feels like, oh my God, what am I looking at? But like, I think it's the ones like the Path Committee and the Monterey one, I think just the initial face value, it just helps a lot, because it goes back to, again, like what audiences we're showing these to. And if their first initial reaction is like, oh, that's a lot, they're not gonna be able to like be less keen about it, like, oh, I don't wanna look at that and everything, yeah. I mean, I do like the Bucks County one, yeah, it shows a lot. I do like the fact that it has like all the filters and stuff, but I just think it needs to be presented in a different way. And I think the Monterey one is really good, and I think it's a good example of follow up of and everything.
Well, I hope everyone will be put at ease. So we do not have the budget for this fancy software. So we will be going simple by default, but it's good to hear that like all of that right at the front might be, how it turns. Josie, did you have something?
Yeah, I was just gonna say, I would think that, the people that we're making this for would be people that are used to seeing graphs. So funders, right? The people that you're making this for are going to be, people that have been on committees. I think that the onus is on us, that burden of responsibility is on us to make sure that everybody within the committee is taught how to read graphs. Like I remember the first time I was on a board, I didn't know how to read a finance committee report. And I had to sit with someone for hours afterwards to help me learn how to read this so that I could ask intelligent questions. And I remember feeling like I should know this, but I don't. And I think that it is the responsibility of us to make sure that everyone on this table is aware of how to read this in this room. So then when we go outside of the room, everybody is speaking the same language on the same page, using the same words and same definitions. And so whatever we use, there is going to be a level of teaching to everybody. And there is going to be a learning curve for everyone. There's also multiple ways that you can do graphing. Like I have an app that I get for free that I do my budget on. And when I want to see my budget, I can see it in a circle. I can see it like this. I can see it like the stock market. I can, and so people have different learning styles, and people who are visual are going to need something a certain way. Some of us read 50 books a year. Others of us read 2. And most of us listen to it on audio or podcasts, So recognizing that there is a vast majority of how we take in information, how people learn, and just making sure that whatever comes out reflects the learning styles, the visual, the audio learner, and just going back to those simple educational principles. How do we teach? As how do we disseminate information as well.
And to piggyback on of that, also being aware that these materials are publicly posted.
So outside this meeting, someone might be perusing materials, and if they can't review these materials and understand what's going on, we don't want them walking away with the wrong impression of what the data means. We're trying to be as direct, as clear, as accessible as possible.
I didn't.
Yeah.
I see Gino's hand raised, and then I'm going to try to summarize some of the stuff I've been hearing in the conversation so far. So go for it, Gino.
I guess backing off of that and maybe playing a little bit of devil's advocate. I know that for example, the people who tend to sit in these rooms tend to be familiar with the field and the space, and like our service providers or care providers or navigators or coordinators, and like are more likely to know for example, what an acronym means at all, And I do think that there's going to be like learning all around for like learning these type of tools, but just like highlighting up what Jamie said, like there might be somebody who has none of that experience and wants to get involved for maybe the first time, or like but is not on the committee. So then they don't have an opportunity to have that crash course, and they, might just be like, I don't understand what's going on in this graph. So I guess I'm just like putting that out there. It's like something that came to my mind.
Good.
Thanks, Gino. So just to kind of recap some of the themes I've been hearing, been definitely hearing that there's some support for and against some of the dashboard examples. Definitely hearing some support for particular measures. Also hearing the importance of defining audiences to this dashboard, making sure that the tool is accessible for those audiences and maybe all audiences. And also making sure that people on this committee have the proper tools and training to be able to engage in these conversations in an informed way. So I know I threw a bunch of questions on here, and I know we didn't get to all of them. I think we probably got to most of them, but I do want to spend just a couple more minutes seeing if there's any other comments on how this dashboard relates to the goals of the committee. And thank you, Jamie J, for putting the overarching kind of goal of the committee in the chat, so I don't have to go back in the slides. But just wanted to sit there for a second, because I know audiences defining audiences is going to be important in terms of figuring out what the dashboard is going to look like, what story it's going to tell. And I think in order to inform what audiences you're really kind of focusing on with this dashboard, you have to go back to maybe the goals of what the dashboard is meant to accomplish and how it relates back to the committee purpose. So let's sit there for a few minutes see if there's any comments. So how does this dashboard for you, how does it connect to the purpose that's in the chat for this committee? And how does it inform maybe some of the goals? What goals do you want to see accomplished by developing this dashboard? How do you want to see it used? Everybody's still there, right? Just want to make sure my
Deep reflection.
Yeah. And feel free if anyone wants to reframe what I just said, if there's an easier way to say it. I feel like Jamie S., you had the question that seemed to spark a lot of interest earlier.
Oh, did I?
What did earlier?
I put my own opinion out there. I think one of the main audiences of this dashboard is you all. That's the committee and our stakeholders. So how is this dashboard going to help you do the work of this committee? And you saw in the work plan what our priorities are this year, the activities we're going to be doing. How does this dashboard help you do that? And then, thinking about, I'm really interested in number 4 as well. What other information and resources do you need to inform this project? So, for example, in the past committee, when we redesigned it, because it's too much information, they said we need some context about this. Like when we're looking at just the chart,
great, yay, but we don't actually we don't always feel comfortable that we're all talking the same language. So if you put a couple of bullet points, like what is this data meant to convey and what is it telling us and like what program it's covering, give us the context before we get to the numbers. Think about those sorts of things. Like what is it that you're gonna need to make this data useful to you and how it's best gonna get communicated to you guys. Sorry, Mark, I didn't reframe your question, but I went on one that was interesting to me.
Perfectly fine. Appreciate it. I'll add another thought too, as folks are maybe thinking still. Well, one, I agree. I think Homebase agrees that, I mean, the main audience of this dashboard is going to be this committee, because this committee is not only going to develop what the dashboard is going to look like, but also be reviewing the dashboard on a regular basis. And we'll eventually have conversations about what that kind of review and analysis is going to look like and what it could lead to in terms of action and products. But yeah, certainly this committee is going to be, you know, the first place that that dashboard goes. And so definitely important for everyone here to, as someone mentioned earlier, to have the, to feel comfortable engaging with the data and the dashboard and be able to have conversations, informed conversations about what it's telling, or the story that it's telling. The other thing I'll just mention is that I think, I know a lot of people probably have thoughts about which dashboard type, which data indicators you want to use. Homebase staff would definitely recommend that you start off with something really simple. And that you go from there, and maybe you decide to build it out. But, you know, starting with like 1 or 2 measures and figuring out how to best illustrate those particular measures could be a good place to start.
See, we're almost at time, so rest assured, this won't be the last time we're talking about this. But really encourage folks to take content in. I volunteer as tribute Jamie Jeanette to help with folks who might want to access a recording or recap of this meeting, to really think about it. So as we come into our next meeting and kind of keep digging more into like, what is it exactly the data that you want? What is it exactly that we have within our power of HMIS to pull out? You guys can come prepared with that. Kind of some of your thoughts and experiences already.
Awesome. I do see your hand raised, Nicole, but let me just wrap up this part and then I'll come back to you. Is that okay? So yeah, just these discussion questions, as Jamie has said, we're just kind of kicking off this project. Definitely continue to chew on them. And then we're going to bring a lot of these questions and topics back to the next meeting as we continue to build out the dashboard. And then just giving you an idea of what some of the future meetings are going to be and goals around the dashboard. I think at some point we're going to have staff mock up a dashboard for you all to get feedback. We want to, of course, make sure we firm up the dashboard goals, discuss what I said earlier in terms of how to use the dashboard, also discuss any challenges, limitations, and barriers as it relates to the dashboard. Go ahead, Nicole.
I should have lowered my hand. You already answered my question.
Cool. Perfect. Love it. Okay. So I think that's it for that section. Am I passing it over to someone? Jamie
Yeah.
J, perhaps?
If you just go to the next slide, the main thing I wanted to figure out from this group right now is that November meeting, just so we can like nail that down. And Homebase, I didn't check with you guys about your availability on the 4th versus the 18th. It's a federal holiday on the 11th. I don't know if folks have strong feelings one way or the other, if we should just make an executive decision, but just wanted to flag that.
Executive decision. Yeah.
Okay.
Okay.
You tell me.
What
I mean,
day?
go ahead.
What day does it move to the 4th or the 18th?
Yeah, if it's both the Tuesdays,
I could just tell you right now, looking at the calendar, I don't know if anybody in this group goes to Behavioral Healthcare Partnership on the 18th, but that conflicts. There's a Board of Supervisors meeting on either day.
let's make the 4th then. And that way also we're not gonna like run into people going away. Does that work for Homebase? The 4th open?
Yeah, I think we can make that work.
Great.
Thanks, Jill.
Thank you. Anybody else conflicts? Okay. So the next time we meet in a month, it will be virtual only. You won't need to physically be here. We will send a reminder. You will get information in the council, in the COC newsletter. You have a calendar invite. If you are registered for this meeting on Zoom, then we will send you a reminder. So, and yeah, exactly. We always post the packet the Friday before the meeting, and so that will have all the materials. I think those are all the next steps I have. Anything else you guys have? I think that's it. Look at us, 3:56. Okay. I don't have anything else.
Can I just say one thing?
Absolutely.
I'm really, really excited about the folks who are on the committee. And excited to work with you all on this project and all the other projects that we're gonna do.
I love all the questions.
I'm gonna echo that. This is gonna be a lovely year for the Equity Committee. I'm so excited.
Yay.
Me too.
Love fest.
Yeah.
Awesome.
And it's great that I was able to put everything that's going on out in there and just divulge into this, and it makes me feel inside to know that, that out there is all right here.
I'll also just add, we covered a lot and some of this stuff is really technical or maybe new. So please do not hesitate to reach out. You can always start with me and I'll figure out who's the best person. But your contact and thinking and questions about this don't have to just live in the meeting. So if you realize, as Jamie said, I can get you the recording for this, we're gonna post that, but also if you are starting to look through some of these materials and you're like, whoa, I need a 101, this is 400 level, just check in with us and we will get you the support you need so that you said, people can learn how to read these data tables, and we don't have to make them super complicated, but it is also a skill to learn how to look at this stuff and integrate it so that you can then do something with it. So please don't be shy about asking for support. That's all I have to say about that. I think we're done.
Thank you, everyone.
Be free.
Thank you.
Thank you.
Bye, everyone.